So, Regina, thanks so much for joining us here at Health+Med Wearables That Matter. We understand that you are the Director of Growth and Acquisition for AliveCor. And can you maybe enlighten us a little bit about yourself and about what your role is at AliveCor?
Sure. Well, as you said, I'm the Director of Growth and Acquisition at AliveCor, and I'm fairly new to the company. I've been here for about 5 months, and my main job is to really, help spread the word about our product and grow our user base, and also find and identify new areas and new opportunities for us to get our product in front of people. I think that the nice thing about this company is that every single person here is extremely committed to our cause, which is to prevent sudden cardiac death and also stroke. And I think a lot of people don't really realize how prevalent heart disease and also stroke are. It actually kills more people, men and women both, than all of the 5 leading cancers combined. So it's quite important, our cause, being able to help people identify, understand what the risks are for sudden cardiac death and also stroke, and be able to proactively ensure that they don't have irregular heartbeats, that they don't have high blood pressure. We recently just integrated and we created a partnership with Omron, and we now integrate their blood pressure monitors into our app. So we're able to track heart rhythm, blood pressure as well.
What exactly is the mission of AliveCor?
The mission of AliveCor is to, in the short term, help prevent sudden cardiac death and stroke, and really help get people to understand the importance of knowing certain vitals. So, for example, I think we just talked about, sudden cardiac death is the #1 killer of men and women, and it kills more people each year than the 5 leading cancers combined. And any sort of illness is horrible, but I think that there is just not the level of awareness that there needs to be around sudden cardiac death and stroke and what those risk factors really are. Things you can now, with devices like the AliveCor, the Kardia Mobile, you can proactively monitor your blood pressure. You can proactively monitor your heart rate. And in particular, for people that have either been diagnosed with atrial fibrillation or suspect that they do have some type of arrhythmia, that they can get our device at a really reasonable price point. So that barrier to entry, it's not thousands of dollars for this device. It's $99. And they can carry it with them wherever they are. So if they are having an event or they're feeling symptomatic, they can simply pull it out of their pocket, and within 30 seconds, they'll be able to see if they have a normal heart rate or if atrial fibrillation has been detected. So yeah, that's our short-term mission, but our long-term goal is to really eradicate sudden cardiac death and also stroke.
We talked in the past, but you have some stories from people that have been recently using the Kardia Mobile device. And I'd love you to share that with us and help us to understand why this device is so important to those people that have cardiac issues, and why the need has come that they need to be carrying these.
Sure, I'd love to tell you some of the stories. It is pretty amazing how many people we get that reach out to me, and they want to sit on the phone and tell me their stories, and I'll spend an hour on the phone with people sometimes, and you just never get that at companies. You're usually like, oh, we'll pay you to call us for your time. But I think because this is such a personal device, and we're really making an impact on people's lives, I think I talked to 2 people recently, so we are actually not FDA cleared for pediatric use. We are FDA cleared, we're a medical grade device, we're FDA cleared for for adults. And I spoke to a gentleman recently who called me and said, "Hey, I just want you to know my story. I had suffered with symptoms, and I kept going to the doctors, and every time I would go, they would tell me that I was fine, and I would walk out of there feeling extremely frustrated because I knew that there was something happening, and so I just sort of resigned myself to the fact that, nobody was ever going to be able to help me. And then I saw your device, I bought it, and I was able to take a recording of my heart, simply email it to my doctor, and I was diagnosed with atrial fibrillation. And that story is not uncommon. In fact, I think at the beginning of this interview, we talked about that this is really a labor of love for many of us at the company, including myself. So I am a former heart patient, and I had an arrhythmia as a teenager. This was years ago, many years ago. And I went through the exact same experience where my parents kept taking me to the cardiologist, and they kept saying, you're fine, everything looks great. And, my parents knew I was symptomatic. They would see it as it was happening. So finally, the one day I was a freshman in college, and my roommates in my dorm, I was symptomatic, and I was unable to really function on my own. They threw me in the back of their car and took me to the emergency room. And I was diagnosed with a life-threatening arrhythmia. And so I went through 2 cardiac ablations. And this was years ago when it was the standard of care was the Holter monitor and the event recorders you wear on your wrist. And when I started working at AliveCor, I was on a call with a big hospital that we're working with. And the call was, take us through the process that you go through with your patients. And I said, oh my God, this is 20 years later, and not one single thing has changed.
Isn't that interesting?
It was amazing to me. So this is a labor of love for me, definitely. And, we have a lot of patients. The gentleman I just mentioned was just one example of many people. Again, we are not FDA cleared for pediatrics, but I just recently spoke to a mother, and I let her know, we are not FDA cleared yet. People can use it, and we can't stop people from using it, but we're not FDA cleared. And she just said, you have changed my family's life, because my 12-year-old daughter was diagnosed because of your device, and now she carries it with her at school. It's a life-changing tool, because it allows people that have atrial fibrillation to be empowered, to have that peace of mind at their fingertips. It also allows people who are trying to seek a diagnosis to do it on their terms, right, regardless of where they are. And our device allows you to instantly send that to your doctor via email, and you can also have an overread and send it off immediately to a technician to have them read it.
Nice.
A cardiologist as well.
Wonderful. How do you think that the doctors are handling this new device out on the market? I know the device is FDA approved, so I don't think that there's any issues with physicians, looking at that particular device for usage. But what's the overall sense of, understanding about how the device can be incorporated into their healthcare professional facilities, how it can be recommended to patients? How are they coming out with it?
We have received a tremendously positive response from doctors and the medical community. We're working on so many things right now that I can't really talk about, but they do involve, very well-respected physicians and institutions in the area of cardiac care who are using this to track patients that are post-ablation. They want to monitor their patients, see how they're doing. They want to do medication management, make sure that they understand, what's going on with their patients. And also, we're working with some very big institutions right now as in a proactive way for them to be able to take EKG as a vital, just like getting your blood pressure taken. So, as I talked earlier about our goal, of preventing and hopefully one day just eradicating heart disease and sudden cardiac death and stroke. We are a company we're a technology company. So the more data that we can get, even if it's healthy data, and we take that data and we're able to learn from that. If you take your EKG every morning, you roll out of bed, you check your resting heart rate, you store that in our system. If you have, right now we currently have what's called Kardia, it's premium, and that allows you to see your longitudinal data. So when you take your recordings, blood pressure, and your EKG, you can go back and look at the history and it stores it. We are going to that is a premium service for us. It's in a free trial right now. So in Q1 of 2017, we will be charging a subscription fee of $10, $15 a month for that to keep your longitudinal data. But if you're able to see, and we're able to detect through our machine learning, that there are some differences in what was your baseline, what was your normal, and kind of match those two things up, the blood pressure and also your heart rate. We're hoping that will, we're not hoping, we are working to make sure that those two vitals are tracked, and if there is an issue, that we're able to raise that issue for you.
So Regina, do you happen to be able to show us a demo of the Kardia Mobile?
Yeah, sure, I can. I am going to, it's a little bit, because I have to use my hand, so.
That's okay.
Let's see. And this isn't, so I actually have my cell phone here. The app is on my phone, and I just want to show you that. I'm not sure if you can see this, but.
Oh, yes.
Right here, this one. And I just recently did a photo shoot, so I had to take my case off, but I normally have this case on the phone, so this is how it looks. It's just right on the back. I carry it around with me everywhere. So I want to make sure that you can see the screen here as I'm taking the recording, but the challenge is I have to, this is what you'll see.
Okay.
At first, can you see that well?
Yes.
We have what we call them cards here. So this is the standard EKG. And then if you, going the wrong way, sorry. This is, this is a little wonky, but this is your resting heart rate, which I do take in the morning. And then this is the blood pressure, because I paired my Omron blood pressure monitor with this. And then the last one is a guest recording. So we want to make sure that the data that your friends and family, when you're showing it to everybody, that their data is not connected to yours.
Wonderful.
So let me show you here.
I just want to say one thing, Regina. I love the simplicity of the app. And I think that that is one of the biggest issues when trying to bring about wearable usage, such as this, is that the apps that the consumer side is looking at needs to be very simplified. And I love the simple pictures. I love the simple information that's there.
Yes, it is. We thought that was very thoughtful. I mean, we made sure that was the case, because we don't want the user experience, the difficult user experience, to be a barrier to entry for people. So, when you get your Kardia Mobile, I can't really go through the unboxing experience here, but it's very small. As you can see, it's about the width of a credit card. And it's going to be a little tough here. I really wanted you to be able to see it recording, because it's in real time. So, but I have to use my hands. You won't be able to see it. So I am going to hit, just so you know, I'm going to, my app, I'm going to say record EKG. So these directions here are telling me to put my fingers, hold still. So unfortunately, I do have to put my phone down. To do that. So I'm just going to put my fingers here.
And how long do you have to keep your fingers on that?
30 seconds, but you have to make sure that you're Hold on, I'm moving around too much. You do have to hold still.
Mm.
Okay. All right. You know, when you have it on the back of your phone, you're just simply looking at the screen yourself. You can see the actual EKG recording happening. You can see what your beats per minute are and all that stuff. So
That's okay. I think it's a great demo of how simple that device is, and which kind of leads me to the next question I have for you is about the Kardia band.
yes.
So how is that going to? Because I understand just from the information I've read that you put your thumb, is it, on the band, and then it reads. You know, it senses that, and you have to hold it, of course, for 30 seconds. Is that correct?
Yeah, that is correct. The way it works is you have to have a closed circuit. So you have the Apple Watch on, it's the band, it's a teeny tiny little, lead here on the band. And because it's on this wrist, it's touching this wrist, and then you have to close the loop with this finger. So you just simply place one finger on it and wait 30 seconds just like we did. You won't be able to see the EKG like we see here on the phone just because of the way the Apple Watch is set up, but it will in 30 seconds give you a reading that will say atrial fibrillation detected or normal or unspecified, which is also one of the unspecified. You can actually turn off that setting if you don't want to see unspecified, but it can mean that it's a bad reading. Or I've actually had an unspecified before that I sent right away for an overread just because of my history. And I got, within 15 minutes, I got the report back. It's an actual report that they email to you. You open it up and it says you had sinus bradycardia, which is a slow heart rate. And I do typically have a slower resting heart rate in the 40s. And so if it's anything below 50, they're going to say that's unspecified.
Is there anything on that device, either of the devices, particularly connected with the app, that would, let's say that you feel like you're having a heart attack and that you put your thumbs on that, and is there anything that, if it's really bad, that it gives you an alert to seek medical attention?
No, we don't have that because, excuse me, we are not diagnosing, and again, it is around all of the regulatory issues and making sure that we're compliant. We are not diagnosing you. However, our recordings are 98% sensitive, and there were studies done. We are just the efficacy studies that were done. Our device versus the industry standard Holter monitors were on par, and the in terms of the accuracy and the user experience, of course, is much simpler.
Absolutely. Can you tell me a little bit about anything coming down the pipeline for AliveCor that you're excited about or stay tuned for?
Well, I can say there's a lot coming down the pike, and it's very imminent too. So it's not something that you have to wait a year for, and it's so exciting because it really just closes the loop on everything we're doing, and it's just one more step in the direction of us preventing sudden cardiac death and stroke. One of the interesting things I do want to say, there was an independent study done about sudden cardiac death, and they said, in fact, sudden cardiac death isn't really that sudden because the people that had died, their bodies, they had shown signs up to 4 weeks prior.
Oh.
Because a lot of people, so a couple things, they're not in touch with it, they don't know, and also they don't have access to be able to see these types of things.
Right.
So if somebody who just is a proactive, heart health person who decides, hey, I'm totally healthy, but I want to have this because I want to take my resting heart rate, my blood pressure, I want to know what it is, I want to know when it's not right, something's not right. Or somebody is diagnosed with an arrhythmia or high blood pressure, and they see that, something's just not right with these. They can easily send it right to their doctor. And quite often we do have patients who do that. They take it, they walk into the doctor, and the doctor says, wow, I can't believe you were able to catch that. So we have a lot, like I said, we have a lot of doctors who are just have very positive things to say about the device and who are pretty astonished as well. And, because they want to offer better care for their patients. And also, too, it was funny. We were in the room one day as a company. We were having a strategy session, and I was new at the time. And I was talking about my experience. And I said, my experience as a patient years ago is not unique. So many people out there that go through this. And so when you go to the doctors, you have to remember, although they're doing everything they can to treat you, it's like a white canvas, and they see a little teeny dot of your health. And I remember when I would have those event recorders on, and they would say, well, what were you doing? What were you feeling? What did you eat? So this takes away the need. There's no gap in the data.
I think also it gives both sides of the equation a better logistical understanding of what's going on rather than a feeling of what's going on.
That's right.
I think that the doctors as well as the patients are more interested in looking at something that says that this is what's going on instead of guessing what's going on with a particular patient.
That's absolutely true. It's funny that you should say that, because I had a conversation earlier today with a partner that I'm working with, and I was kind of frustrated. And I said, heart disease is the number one killer of women. Women have more devastating strokes than men, and they tend to die from strokes more often than men do. And, my mom had a heart attack this past October, and her symptoms were, finally, when she went to the doctors, they said, why did you not come in sooner? You almost died. And she said, well, I thought I had heartburn, and I felt silly going to the doctors. And so she spent the weekend, Googling how to get rid of really bad heartburn. Here it turns out she was having a heart attack for 3 days.
It's these types of devices, just like the Kardia Mobile, that need to get in the hands of the consumer, and particularly women consumers need to start to understand how important these devices can be to their health.
That's right. You're absolutely right about that. And I think, a really important distinction I really want to try to make is that we are FDA cleared. We're medical grade. So we're not a Fitbit. And when that example that you gave, I want people to know that this should give them peace of mind, because this is an EKG that doctors use. They look at these strips. You can send it to them right away. And I just got off the phone today. I left several messages for the American Heart Association, Red for Women, Prevent Stroke, and I'm just, Mayo, talking to these people saying, hey, we have to get this message in front of women.
Absolutely.